Okay.
Just know during the competency, you're actually going to be taking every step, not just for blood. So you'll actually be washing your hands, you'll actually be putting on
He told me,
gloves.
well, he said not to waste gloves. So we just
You know,
act
during,
like
on Monday.
Okay.
On Monday, you're going to actually go through
Yeah,
everything.
he
So
meant
just
no
keep that
waste
in mind.
gloves today.
You don't have to worry about it today.
Okay. But on Monday, actually put the gloves on?
Oh yeah, yeah, you're going to actually go through this. This is a real patient.
Okay. Okay. And
Wash my hands.
what's your first and last name and your date of birth?
Senior IT.
Okay. All right. I was
How are you, sir?
Hello. And
Hey,
then
Anna.
we're going to be checking his chest. Have you had a breathing treatment before? And then can I get your name and date of birth? And then I also have to say that I'm checking your back.
Yep, I mean, unless you're strong enough to place him over and listen to his back.
Yeah, so the thing is like, so your criteria, right? So
You usually will.
you, before entering
We're
their
supposed to check
their
their
space,
first. Oh,
well, you do it with gloves on.
I'm not that picky about it, as long as it's systematic and you're making sure that you're covering all your bases.
No, but like in,
Well, covering
when
all
we're,
your-
when we're at clinics,
Yeah.
would you say it's supposed to be?
At clinic, it's gonna be, most ERTs, hey, my name's Thomas, let me give you your breathing treatment.
So while you're washing your hands, you could
Okay, and then just,
pass his name.
Oh.
so, yeah, you don't have to be that
Unless you really want to do it.
over the top about it.
No, I would say just do it. So they don't say.
What's up, bro?
Go through the steps that you need to go through to practice for your competencies, and then once you get into actual patient care, you'll kind of see
How do you feel that?
what the book tells you versus what you do in your life. If you do see people taking shortcuts, think through it. Is that a shortcut that's appropriate? What risks are there associated with taking those kinds of shortcuts?
How you feel about it, Megan?
I feel okay. I just want to practice because, you know, saying what I'm doing.
Dang, you put this on time.
Yeah.
But you do see right side.
I want to fall off.
I feel like the steps now.
This is loose in the wall.
Everyone coming over here? I think that was a yes.
Sorry, sorry.
Well, I think I'll be the last one. So I think
What did you say?
checking on Canvas, your modules. You guys have to check me out.
Yeah, false, next.
Okay.
What else?
And then
What else are you-
respiratory rate.
Okay.
I'm watching the breathe through chest raise.
Yeah. Oh, I can't breathe.
Try switching the tubing around. We take the end that's in there. Try putting that in the bottom of the nebulizer, see if that helps.
Remember, if you guys want to practice outside of this, you guys can use the classrooms too, okay? Because you only have the 3 spots.
Like he cares. Thanks, buddy. You need one more sun.
Huh?
I think you need one more sun. Your eyes are not burnt enough.
Oh yeah, that's one carries them on.
Do whatever you
Skin
think
cancer,
is
what
right.
chunks that I need?
Little things like that.
Not bad.
I don't want to go anywhere.
What are some good questions that you guys can ask when you're doing your actual like, interview portion of your assessment?
How are you feeling? How are you feeling?
Symbol, you can tell them what it is, you can do whatever you want.
You have to explain what they're doing.
I put a lot in there, Michael.
So you can, I always encourage people to ask them about their medical history. Do you have COPD? Do you have asthma? Are you taking medications for it at home? What kind? Do you remember what they are? Is it a nebulizer? Is it an inhaler? If they do say that they're using nebulizers and inhalers, how often are you taking your inhaler? How often are you having to use your rescue inhaler or your nebulizer? What's the leading cause of COPD? Okay, so if they have a diagnosis of COPD, like this patient did on their chart, you can ask them about their smoking history. Do you smoke? How much do you smoke? How many packs per day?
Will
How
the
many
professor talk back to us if we're just talking?
Some of them might.
And the talking actually gets them to actually take in the medicine more.
Not necessarily.
No, oh,
The
okay.
mask is kind of irrelevant.
But if you want,
This one's Ed.
IRL.
Then coffees.
You're in an ER and you're having to do the treatment and the patient's bent over in bed, huffing and puffing and really working, you're probably not gonna do a verbal interview. Because they're barely even gonna be able to talk. They're struggling to breathe, they're not gonna be able to talk. So then you get something going, and once they start to feel a little better, then you can say, tell me about what's going on, how long
Take it off.
have you been feeling like this?
Whatever's easier.
When it starts sputtering, does he want us to?
He would always use the side of his thumb to flick the side of his nebulizer.
Maybe you can do all of them.
That's some long-term use.
We knew him by name and appearance. Oh, so-and-so is here. We always knew his preferences. You'll get frequent flyers. Patients that are in and out a lot for exacerbations.
That's what you call them, frequent flyers.
Frequent flyer.
Wash hands with some less.
Alright, how are you feeling, sir?
Are you gonna say
How are you
anything?
feeling?
Where's my backpack?
No, for
Better,
don't know.
so that I would recess and I would
Okay,
check
you're scheduled to have one of these breathing treatments done every 4 hours. But if you start to feel like you're having a hard time before I see you again, let your nurse know. I'll come back and
Don't
take care.
forget, I forget.
Something along those lines.
Common
Thank
please.
you.
Let
Let him know. Yeah.
Well, so chart, do I say, oh, and then I chart the results?
A lot of times too, instead of standing there and staring at him for 10 minutes,
Okay.
Yeah.
you can chart.
And then
Okay.
do
While
your
the treatment's
breakfast
going,
again.
save time.
I'm gonna go ahead and.
You're
just
supposed to,
breathe.
chart
One,
your bedside
two,
to be
Go
like
ahead and
charting.
check your breathing.
And what are you expecting for your staff?
Okay, who wants to next?
Your bed staffs after the treatment?
The minute.
You just cough.
The minute?
That's what they said, no more breathing.